We've talked about that our testing numbers are still quite very high, and they have to come down substantially, and to see that they'd have to progressively go down over a 2-week period to a better level. And we're going to ask our experts on that and our public health measures group to look at the various metrics to say, are we at a stage when we can start to engage in the first phase of the first 2 to 3 week period in there. So this is all saying, here's how it will go. Right now, we're still in the pandemic phase. We still have numbers well over 400. We just came out down below 600 and 500. So we have a ways to go before we get to start our first 2-week period in that light.
Let's bring on somebody who's been tracking the numbers every day. You know Dr. Jennifer Kwan. She's joined us on the show several times. Welcome back, Doctor. Thank you.
Hi, Kristy. How are you today?
I'm doing just fine. What is your impression of the numbers that we're just seeing coming out of Ontario this afternoon?
So there has been some good news over the past couple of days. The number of total active cases in Ontario has been decreasing for the last 2 days, which is a good sign. However, we're not out of the woods. There's still quite a high number of new cases today, as you mentioned.
Mm-hmm. When you were hearing Dr. David Williams, they're saying we're not quite into phase 1. We haven't seen the right numbers yet. Does that line up with your opinion?
I think for sure we still need to be very, very cautious. I don't think that given our numbers still having 400 plus new cases a day, that we can, start stage 1 and start reopening. I think there's definitely going to be a very cautious approach in ensuring that workplaces and parks and things like that are safe before we reopen.
Mm-hmm. The Chief Medical Officer of Health also said 50 to 60% of new COVID-19 cases are coming from the community, not from long-term care or healthcare workers. I thought that was interesting.
Yes, I think that definitely long-term care residents and staff and other healthcare workers take up a significant portion of cases. However, long-term care residents actually take up an even higher number of deaths. So I think it's approximately 70% right now that the deaths are attributed to long-term care. So even though we see these overall numbers of cases and deaths, we do have to take into account that it's occurring in different settings and we're just seeing an overall number or an average.
Mm-hmm. In the stages I described, which are quite light on details, they don't specify what workplaces, they don't specify what number of people would be permitted as they start to ease restrictions. From your sense of the numbers right now, when do you think it would be appropriate to move into that phase 1 of select workplaces, some outdoor spaces like parks, and allowing small gatherings like funerals?
Well, so right now, if we're looking at the graph of new cases, we see kind of us riding up the curve, and we may be at the peak right now. When you're riding a roller coaster to the top, you don't just hop off at the top. You have to come back down. And it did take us approximately a month to get to where we are. So it's going to take us approximately another month to come back down or more. So it's hard to say. We do have to keep a careful eye on the numbers. I don't think we can speculate on like an exact date, but I think it will be, at least, late in May or depending on whatever the public health officials say.
That's interesting. So because you say it took us about a month to get to the top, to even get to that phase 1, to be safe, and again, this is just an estimation, you're thinking late May, and then even beyond that, to get to phase 2, they're saying it could be 2 to 4 weeks until we move to the next phase. I guess the concern that a lot of listeners have and what people will be wondering is if it takes us a month to even get into phase 1, and then it could be up to 4 weeks for every stage that's subsequent to that, what happens if this takes us to mid-August, late August, and then all of a sudden we're hit by another wave?
Yeah, I think definitely people are, everyone is feeling very anxious and hoping for the economy to open. Businesses are being affected. Many people are affected on a personal level also. I do really wish things will open as soon as possible. However, we have to do it in a safe manner because right now we may have been flattening the curve, but if we hop off the roller coaster at the top, that doesn't make the curve stay flat, that just means we delayed the onset of cases. We will have another wave if things are reopened too quickly. So, everyone's doing a great job. Like, keep it up, but we have to be patient in making sure things are done properly. And I think they did also mention things like public health measures that we can implement to help ensure a safe reopening. And that will include increased testing, more masks being used in public, things like that to help reduce infection risk.
Dr. Kwan, thanks for coming on the show. I appreciate it.
Thank you.
Dr. Jennifer Kwan, family physician in Burlington, Ontario.